Hi, this is Dr. Stephen Evans. I'm the publisher and editor-in-chief of Outclick magazine. We hope everyone is doing well and making the best of things during these quarantine times. We've been doing several interviews and talking to people in the community. Today, we're happy to talk to Dr. Marcia with the Acupuncture and Wellness Center of Fort Lauderdale. Marcia, you're a great person to be talking to and a joy. We're happy to be here in your office. You recently moved here. Tell us about when you came to Fort Lauderdale.
I moved to Fort Lauderdale from Chicago, from downtown Chicago, where I had a practice. And let's see, it was right around Halloween. Then I built this all out, got everything ready, opened up, met you beautiful people, and everybody got quarantined.
Everybody got quarantined. So you came to our sunny Fort Lauderdale all of a sudden and opened up, and we got to meet.
I've been to the beach twice.
Been to the beach twice.
And I have been stuck in my house since. And because I am a doctor and I've been seeing patients, even though I see them one at a time, I don't even go to the grocery store. I have been nowhere. I have not had contact with anyone. Okay. Everything is washed and brought to me after it's washed.
Okay.
People change their clothes when they come into the house.
Okay.
Although I feel like it's kind of extreme. I feel like I just don't want anything to come back to me or to be irresponsible. So I have been overly responsible during this time.
This is a very sanitary environment and office. Yes. Tell us where we're at. Where is the office?
We are at 1128 Southeast 3rd Avenue in Fort Lauderdale. If you guys know the landmark State Farm building, this used to be an old home. Okay. I'm in the back of the State Farm building. Okay. And I have quite a large area. And I have doors upon doors, so it's easy to keep people away from each other. Okay. And
you're across the street from Broward General.
Yeah, Broward General is right down the street.
Just a couple blocks away.
Yeah, so I'm kind of in a medical hub.
Okay.
And I was hoping to, work with other doctors and be more of the medical community. But that'll wait until people feel more comfortable.
Sure.
Networking again.
Yes.
So
what kind of services do you offer here? Tell us about the acupuncture treatment.
So the treatments that I love to do and that I typically do is the gateway, as I call it, the coming into finding acupuncture and acupuncturist tends to be pain.
Okay.
So, the tennis courts are now opening up again and basketball courts and people are kind of getting out and about more again. And so they haven't used their bodies in a few weeks. This is a great way to deal with aches and pains, to get back your stamina, that sort of thing. I also treat anxiety and depression, OCD, things of that nature, kind of feeling like, we kind of all feel a little bit trapped. This raises dopamine and serotonin levels.
Okay.
Very strongly. So it's a natural mood elevator. So I've been doing a lot of that. And with that being that the needles are a foreign object, even though they're the size of a hair, they're so tiny you can barely see them. It activates your immune system. Okay. So people have been building their immune systems. I have very elderly in their 90s patients. I have patients who are over 70. I have not seen any sickness at all, and I'm not saying that's just me or whatever, but I've been very vigilant about making sure that their immune system is primed and that they're feeling healthy and they're not in pain, which also can decrease immunity. Mm-hmm. If your immune system's busy doing one thing, it's not necessarily busy protecting other things. So we want to make sure that your wellness machine is running really, really well. And because we're not having a lot of contact with other people, we don't want our immune systems to get lazy.
Okay.
So this is a good way to keep everything flowing, just like being in the sun, putting your hands in dirt, all the other things that virologists are telling us. Acupuncture is a great complement for that.
Okay.
I also do face stuff.
Okay. So we'll talk a little bit about, so it's also great for relaxation. I came and had a treatment, and we're going to put up, if we can find them, put up some photos when I was here and had it done. And if you've not ever had it done, you barely even feel the needle prick.
If at all.
I'm almost having to even call it a needle because there's so little feeling in it when you have it done. And it's really an interesting feeling. And it's very relaxing. you come, if we can put up the photos of when I was here, it is very relaxing. You have music, and it's a time to come and rejuvenate yourself, and for anxiety and depression, and it's a great way to help combat those things.
It's a great reset.
Mm-hmm.
You can also, a lot of times people just feel like, I liken it to, if you're an athlete, a runner's high
Mm-hmm.
when you leave it. So a lot of times we discuss your case. We go over a treatment plan. We agree to that treatment plan. We do all those things before I treat, because as you've had a treatment,
Mm-hmm.
you are feeling no pain.
Mm-hmm.
You're just like, I don't want to make decisions.
Mm-hmm.
I want to go eat some good food. Maybe, if you enjoy a glass of wine, have a glass of wine. If you enjoy chocolate, have some chocolate. Something like that. Like, I always tell patients, I'm like, go watch something funny.
Mm-hmm.
Go to a movie, go to theater, go out to eat after you've seen me. Like, do something for you. When we can go back to the beach, go to the beach, take it in to like reinforce what I've done. Because it is a mood elevator, isn't it?
Mm-hmm. It is. It's very relaxing, very good.
And it makes everybody super smiley.
Yeah. Yes. It's a great way to rejuvenate, especially if you've not been able to get out of the house. Mm-hmm. It's a great way to come, get out of the house, get some sunshine, and then come into the office and just have a chance to rejuvenate and relax. I know this is a very stressful time for people, a lot of anxiety, a lot of depression, a lot of loneliness.
Mm-hmm.
Dr. Marcia's energy alone, when you come and talk to her, is worth the trip to the office, and then you get some time to relax and rejuvenate. It's a really great experience.
Well, and this is a really good time because I know that I can have more people in here, but especially on the first time I'm seeing a patient, I'm not sure. I haven't met you, so I want to make sure that you're very insulated and protected. So I want to meet a patient one-on-one, meaning I'm here and somebody's either 2 doors away and well on the other side of the building, or you're just meeting with me. So, it's a great way to spend some time, get out of the house, but also still feel safe. You're still in a very safe environment. I am very much quarantining. Even after this is pulled back, I will still be quarantining for your guys' protection, just to be extra safe. You've seen how beautiful it is out there, peacocks and all sorts of fun stuff. So some patients do choose to get treated outside if they still don't feel safe coming inside somewhere.
Good.
And then you can sit in the sun even longer.
You can sit in the sun even longer. And some of it works for facial rejuvenation, as you were saying.
I really do a lot of facial stuff. And in this time, people have been taking advantage of not being around the public so much. And as patients have gone back to like playing tennis, seeing, going back to work, that sort of thing a little bit more, they've been getting comments about all the facial work that we've been doing behind the scenes. It just brings a lot of blood to your face. And the other thing that we notice is the stress reduction that you were talking about, which happens regardless of what I'm treating on a patient. But also people report eyesight improvement because it increases oxygen and blood so much of the face. If they have any type of pain or pressure or headachiness, or we're in allergy season, that tends to get better. Any type of nasal congestion, the face stuff, just think of bringing all that blood to your face. It's just anything that goes on, jaw pain, that sort of thing. Tends to resolve itself, and then you're gorgeous on top of it.
So how long when someone comes in, are they here for an hour, or how long are they here for usually?
So when I first meet a patient, you'll fill out your forms online. I'll send them to you. Fill them out, send them back to me, just so I get a baseline of what we're doing. But then I want to have a one-on-one chat, and that typically takes between 5 and 10 minutes. I want to treat you where you are, not necessarily what happened 20 years ago. You can tell me that the etiology, the beginning of it was 20 years ago. That's fine, but I really want to treat you where you are now. So that's 5 or 10 minutes. If I'm doing ortho, it's typically 10, 12-ish minutes for a position. You can't leave the ortho needles in forever. To do the immunity and relaxation part of it, though, I put in all the needles I need. If I have to remove the ortho ones, I will. And then all said and done, you tell me. Let's do a minimum of 20 minutes. But if you want to do 30 minutes or you want to do 40 minutes, then I think that we should do what you feel you need to do, especially if you haven't been out of the house in 3 weeks. come hang out with me.
Yeah.
Take a nap.
Yeah.
So I'm really flexible.
Good. It's very good. It's very relaxing.
Yeah.
So
it is.
And then you've changed over the office and everything because of the COVID-19. It's very sterile. Your personal life and all that. That's been a question we've asked everyone, but you've obviously made many accommodations, both personally and professionally, to make sure your patients are safe here. And so we've chatted about that several times about how many steps you've taken for that here.
Right. And please, if you do have a fever, or if you have been exposed, or you feel like you have been exposed, just stay home 2 more weeks. So, again,
Go back 30 seconds.
Go back?
what do you mean?
Ask again.
Oh, so the office, you've made a lot of steps personally and professionally to make sure that everything's sanitary and clean.
Yes.
And everyone's protected.
Yes.
So, yes.
So I've always been extremely clean when it comes to the office, and I have a medical degree. I have a license.
Okay.
So, as far as the Lysol wipes, so I've always had that. We always make sure that there's not cross-contamination between patients. I do ask that if you have been exposed recently, or you believe that you may have been exposed, if you're running a fever, if you have a family, whatever it is, I would ask at this time that you do wait the 14 days before contacting or leaving your home, just because I want this to be a safe place for people to stay well. Unfortunately, I don't want to be in the position of treating the virus at this time. And that's just for everybody else's safety. Because it's such a new thing. We just don't know all the ramifications of having that in my practice. So if you're healthy and you want to stay healthy, or if you're having bad allergies and you're not sick and everybody thinks you're sick because you're coughing and your nose is running because we're in allergy season, come get it fixed. And then people won't look at you funny when you leave the house. I have been noticing people are afraid to cough. They're like, oh no, everybody's gonna think I'm sick. So I have been seeing allergies more now too.
So it's great. So come for anxiety, boost your immune system, depression. It's great for treatment of pain management.
Just get out of the house.
Get out of the house, and for some facial rejuvenation, some relaxation, and come experience Dr. Marcia.
Yeah,
it's great.
You're welcome.
How can we find you online?
I'm on Facebook. I'm at Acupuncture and Wellness Center, Fort Lauderdale. Yelp. I'm at Acupuncture and Wellness Center. I believe it is up at Fort Lauderdale, but I'll pop up. You can't miss me. Google Maps, Acupuncture and Wellness Center of Fort Lauderdale, or it might just be Acupuncture and Wellness Center, but my address is 1128 Southeast 3rd Avenue. Also, I know that.
Do you know your phone number offhand?
I do.
Okay.
It's 954. I moved here from Chicago. 954-494-9322. And then you can also text me at that, because I can't have an assistant here right now. It's just me coming and going. I have it with me all the time. And so not everybody enjoys talking on the phone. You can text me. Make an appointment that way as well.
Cool.
Yeah.
Cool.
It's so nice to see you again. I'm so happy that you came by. Are you ready for your treatment?
I am.
Yeah.
I am. Did we show the pictures of when I was here last? Good. Yeah. We showed the pictures.
I'm going to get you all hooked up.
Good.
Yeah.
And check us out on Facebook at facebook.com/outklick and youtube.com/outklick. And be sure to text OCQ to 22828 for more information on us and to stay updated. And of course, more information at outklick.com. So we thank you for talking to us. Maybe we will do a video of a treatment.
Oh my gosh, that would be great.
See what it's actually like. It's a really fun experience. I've done it with a couple others, and it's a fun experience. So we look forward to it. Come down and get out of the house, get rejuvenated. It's been a hard time for a lot of people, including myself. It's been some tough days, and so don't sit home alone. Reach out to people. There are friends and families and practitioners that are available for assistance, and this is the time to reach out to them. So
and really honestly, it does so I can't stress it enough. It increases dopamine and serotonin levels. So if you're feeling like you may be on the verge of PTSD from all this, which some people are, the feelings of loneliness, of feeling trapped, of all of those things is linked to dopamine and serotonin. So this is a great healthy way to get those to increase naturally, and let your body take over and kind of start doing that on its own, which is a better solution than self-medicating in other ways that aren't as healthy.
Do we have any questions from anyone? So,
all right.
Well, thank you so much.
Thank you.
Have a great afternoon, everyone.
Bye.
Bye.